If you have a wound that is just not healing correctly and well, many would head to a primary care doctor, the urgent care center, or perhaps the emergency room. But there is another option out there. Here to tell us more about the benefits of a wound care center is Hartford Healthcare's Dr. Lee Goldstein, medical director of the St. Vincent's Wound Care Centers. Doctor, thank you so much for being with us. First off, what is a wound care center, and when should a patient come and see you and members of your team?
Thanks so much for having me. Good morning. I think that most people in the general public don't know that we have such a thing as a wound center, and many physicians and other specialties in the medical profession don't know either. Our motto is that we treat any wound anywhere on the
Hmm.
body, and sometimes people don't even know what a wound is. It's a break in the skin. It's also sometimes called an ulcer, but a break in the skin, and that could be due to diabetes or trauma, burns, falls. We
Hmm.
see a fair number of falls in elderly patients, surgical wounds following an operation, or vascular wounds. So, really, any wound anywhere on the body.
What are some of the more unique types of treatments that you offer?
So, one of the things that a wound center can offer that the average primary care office or even an urgent care can't quite provide is some of the more wound specific therapies, such as debridements, which is a wound cleansing where we help to clean off the wound, biopsies to help evaluate what's going on the wound, as well as multiple advanced biologic therapies, things like artificial skin, things like high dose hyperbaric oxygen for certain types of
Hmm.
wounds. And then we also manage quite a bit of the referrals between other physicians and the wound center to make sure the patient's on the correct medications and getting all the things they need to help their wound heal.
Now, is there a certain type of medical expertise that members of your team have to be part of a wound center?
Yeah, and I think that this is really critical because there are other places in the world that practice wound care, but I think that we're pretty unique in that we have a multi-specialty group, including general surgery, trauma surgery, vascular surgery, podiatry. This gives us a very broad, board certified
Hmm.
backed group of people that are experts in their fields. And because of that, we refer within the groups to each other if someone has a specialty that is particularly appropriate for a certain type of wound.
Doctor, final question. Do patients need a referral to come into a wound center, or can they just stop in on their own?
They don't. We have two wound centers, one in Stratford and one in Trumbull, and both locations are now accepting new patients. They do not need a referral. We usually accept patients who self-refer. And any primary care doctors out there or other referring doctors out there, please feel free to send your patients our way.
All right, Dr. Goldstein, great information. Thanks for being with us.
Thank you.